How to correct straight lumbar spine using corrective chiropractic care. The x-ray on the left is showing a normal lateral lumbar spine with a normal lordosis. The x-ray on the right is a straight lumbar spine, which is more associated with disc bulge, disc degeneration, and other associated pain symptoms in the back and leg. So we need to introduce corrective chiropractic care to help improve that straight lumbar spine. And we start off with warming up the lumbar spine, sacrum, lower lumbar discs with a pelvic tilt exercise. This unique wobble chair called a portable wobble chair can tilt backwards and frontwards, but we want to focus on the anterior pelvic tilt only. Anterior pelvic tilt will help induce a normal lumbar lordosis, or at least accentuate that lordosis, and also get the pelvic tilting forward also, which helps with that normal lumbar lordosis. Now I get the patient set up on our traction system. This is a chiropractic biophysics technique. We're using extension, traction in the lumbar spine. You can see as I strap the patient underneath the lumbar spine and I'm pulling with the pulley, I'm actually inducing a lumbar lordosis. We're decreasing that straight lumbar spine and improving the curve into this normal natural lordosis. We need to overcorrect to get that ligament creep changes to get that spine to reform into that normal lumbar lordosis. Again, you see in the model, I'm using the same system, the Deneral table here, and you see how the model is being curved into that normal lumbar lordosis, which helps to reduce that straight lumbar spine. A straightening of the lumbar spine will eventually lead into degeneration, disc bulge, and other associated low back and leg symptoms. We can also do this in a seated position. Now I'm showing the universal traction system. Again, this is a chiropractic biophysics corrective care technique to help improve the lumbar curve for a straightening of the lumbar spine. We're using this crank here and a strap around the lower lumbar area to induce that normal lordosis, get it overcorrected in the traction position. During these traction setups, the patients will be on here up to 15 to 20 minutes, but we build up to it to 2 to 3 minutes every session till they get to that 15 to 20 minutes. Now we need to send a patient home with some home care. They can do a home lumbar Deneral to help do home traction and reduce that lumbar spine at home on the days they're not in our office doing our structural rehabilitation care. You'll see here the patient's lying on a small lumbar Deneral, which is uniquely designed to actually reshape the spine into that normal lordosis and get that curve in there. Here's a medium-sized lumbar Deneral, which is better for taller patients that need a bigger push on their spine to get better lumbar lordosis. You'll see how the lumbar spine model bends over the unique shape of the lumbar Deneral to help improve the lumbar lordosis and correct the straightening of the lumbar spine. Now be sure to watch the next video on your screen to further your learning about this technique.